Royce Regional Health Network welcomes you to the Equity Circle podcast.
Hello, and welcome to another episode of the Equity Circle podcast. And today I am joined by Cole Meckle from Gather Church. How are you doing today?
I am well, Katie. How are you?
Doing very, very well. Thank you. So today we're going to be talking about the pandemic and COVID-19 and how it's affected the community. So I wanted to start with asking, when the pandemic first began, what did you see as the impact in the community and how the community responded?
Yeah, so it feels like a while ago now, right? But initially, people were really confused. And what is the impact of some of this going to be? Is this for real? Is it not? Are we looking at long-term consequences, or is this a short-term situation? A lot of just lack of information, which, quickly became too much information. But initially it was a lot of just confusion, concern. As far as like mobilization, there was a lot of it not long after it became clear that this was a serious issue that we needed to make serious adjustments concerning. So we had among the many things that we get to do in our community, one of them is a lot of food service. And so we serve a lot of hot meals in the community, as well as distribute groceries in the community as well. And so one of the things we needed to make sure we were, trying to protect the community concerning would be the spread of COVID, interacting within those two contexts, among others. I'm just using these two as an example. And so it was like, how are we going to make sure people are getting the food resources that they need while also mitigating the potential spread of COVID? So, I don't know that we were articulating it quite that way in the moment, but generally speaking, that's what we were trying to accomplish. And people really were willing to do whatever needed to be done amongst our volunteers and other community members and our staff to help address those concerns. And we have an inside space. People can sit down and eat. We ended up having to close that. And of course, then what we did is just served hot meals through a pass-through window outside, making sure people continued to get the hot food resources that they needed. And then probably one of the things that was most amazing is that we pretty quickly pivoted our food bank to a food delivery service. And so one of our board members is an IT guy, so he built out a new website quickly, and people could go online, gatherstockbox.com, and order a food box. And we decided we would deliver food to people's doorsteps, no contact. And that was an amazing. It's been amazing. It's still being done that way. It's one of those things that will stay as most likely a permanent change going forward. But it was amazing to watch people respond, to watch people get involved, to watch people show up and be willing to drive and deliver food boxes. Lewis County and we deliver to all of Lewis and the southernmost parts of Thurston County, and people that were willing to just no contact, come show up, load up boxes, and drive them around the county. It was amazing community response. So it was very positive in that regard.
Wow, that's amazing. And I'm just curious with that, how much of the community do you feel, really got involved with that process and being willing to kind of work throughout the community?
Yeah, I don't know. I don't know how to put a number on it. I mean, we had, I would say, initially 25 or 30 different volunteers, some of whom had been involved. And then as the weeks progressed and months progressed, I would say there have been 100 different volunteers approximately that have been involved in some capacity with picking up or dropping off or helping pack food boxes or whatever. So there's been a large community involvement and willingness to get involved however they could within their own availability and everything, right? There were a lot of folks that would call and, just lend their support and encouragement. They couldn't necessarily get directly involved because of their situation or whatever, but they were very appreciative of what was happening and just wanting to make sure that we were being encouraged. And some of that is funded through just private donations as well. And so people would also, share the love and encouragement through just donating to the cause as well. So, yeah. it was a pretty significant response, positive community response and engagement involvement. So yeah.
Excellent. And as a faith leader and community leader, how did you feel like that kind of impacted you in terms of having to make all these adjustments with having to switch to more indirect things? Like how did that affect what you saw happening?
Yeah, that's a really thoughtful question because it was really hard. Everything we do is around establishing relationships with people. I mean, we're not certainly looking past any immediate need folks have, but one of those immediate needs people have is for human involvement and being a part of something and sitting down and two people or 10 people or whatever actually sharing life together. And COVID certainly had thrown a wrench into that because it became obviously really hard, not just for the direct service stuff, but just in general, communicating and sharing life together. And it was really hard to watch, not just the spatial distance, but the emotional distance and the spiritual distance that was created in the pandemic. So it was very hard to watch, and it touched everything, and it still is, right? That's probably one of the most lingering impacts of the pandemic has been the relational distance that's been created and the the emotional instability that's been outcome of that lack of human involvement and engagement. Folks, just struggling with behavioral health and with substance use and relapse and all of that, right? It's been pretty devastating, and that just continues. So it's been a journey of trying to nurture our community and individual community members back to health. One of the things we experienced after we opened our cafe back up is a clear example of just what I'm talking about. After having been closed for inside service for almost 2 years, we opened back up, and what we found was a lot of instability, a lot of people struggling, a lot of folks not even really knowing, I guess, or remembering, or maybe ever having really known what it looks like to share some life together and to be in close proximity with one another. And we have had to change the way some of our things are being operated just because of some just general unrest and lack of wellness behaviorally among, again, the groups of people that are frequenting our cafe. And it I don't know, it surprised me on one hand. On the other hand, it was something we were expecting. Maybe it was just a little even more extreme than what we were expecting, what I was expecting. And so we've had to make some adjustments in how we operate, and it's not bad, and we're getting there. But we've limited the amount of time that we're open, which makes me extremely sad, especially this time of the year, although we're about ready to extend our open hours and basically try and have case managers, behavioral healthcare workers, and peer counselors and a bevy of different service providers internally and people from the community at large participating within the open time, so that there's a large mix of people as well as a large number of opportunities to connect with different resources in the community, again, as an attempt to kind of slowly bring people back together, but also make sure that there are clear pathways that are available for folks to engage in some services that will help them, right? So, and it's actually been beautiful. I would even say, aside from still not being open at the cafe normal hours, it's been more upside than downside to being extremely deliberate about a lot of that, and that overlap with service providers and just people in general, along with our general clientele. So.
Wow, that's so innovative. And you've mentioned like the food delivery and doing the drop off on the porch, and it sounds like connecting multiple care resources through the cafe to really address things like behavior health. Are there other kind of innovative things that you guys have used over the last couple of years to really address some of the changes that have occurred?
I mean, yeah, not necessarily have some of those stuck. However, they've given us, and I'll explain a couple, but they've given us additional approaches to addressing things that we are putting into use in other ways. So, like for example, we have a low barrier medication assisted treatment program, and so it's drop in, schedule, whatever. If you are struggling with OUD, opiate use disorder, and you're interested in recovery services and treatment and medication assisted treatment, whatever, low barrier, you show up even without an appointment, and you'll on most every night see a care navigator, you'll see a nurse, you'll see a doctor, and you, if you're a good fit, you will walk away with your script in hand and maybe even transport to the pharmacy and assistance in getting your needs met, whatever they might be, as far as transportation or access to medication or whatever. So anyway, when that started, right, we started that program right about the time that COVID came upon us. And I remember we worked closely with the ADAI and the University of Washington in that program, and I remember discussing with a couple of folks there, like they were, are you all sure you want to move forward with this, given what seems to be coming? And we're like, yeah, I mean, we can't not keep going, so let's keep going. And of course, it posed numerous challenges, one being obvious: without easy ability to see folks face to face, that was very challenging. And so we instituted of course, a telehealth type model, and with some level of success, I would say. One of the challenges, though, of course, is that some of the folks that we are serving are not currently housed or don't have the technology that they would need to do a telehealth visit like others maybe would if they were seeing their regular doctor telehealth or whatever. What we did to address that was have a tablet available, and with Wi-Fi connection to our own Wi-Fi, we would have people show up on site. They would see the peer and a receptionist. They would get them logged into that device, and they could take that device on some other part of our property or to their vehicle or whatever. They could do their visit with the care navigator and with the nurse and with the provider while they were on site, but not face to face with one another. And of course, this is always challenging and less than ideal. And so as things have opened back up and we've been able to return to a more ideal, we aren't doing that. However, we are looking to do more mobile medication assisted treatment work. And so we will reinstitute things like that, not with the not in quite the same exact fashion, but with the client on site at the mobile unit connecting with a provider at a different location, but with the care navigator and the nurse on site with the device or whatever. So anyway, yeah, I don't know. It seems like all of that is so far in the distance, and so many people have pivoted to doing telehealth. Now it doesn't feel very innovative at this point, because like telehealth has become, well, and virtual meetings have become so much the common thing, right? It doesn't feel very innovative, but it sure did at the time. It was like, oh my goodness, these are the hurdles that we are facing. What are we going to do to overcome them? And I'll tell you, so much effort was put in, not on our part, but on so many people's parts, behavioral health providers and medical providers, and everybody just trying to work hard to meet the needs of their clients. And so it is amazing to look and think back on it a little bit about how much work and how much effort went in to making sure that people were having their needs met. It's challenging as it was, and as hard as it is to think about in some capacities today, it's really beautiful looking back on it. Because most everybody that I know in this work was focused on how do we make sure that our clientele are being served in the way that they need to. So yeah, it's beautiful. Yeah.
And telehealth, I definitely became much more of a platform, I think, than ever before. And as you said, it kind of brings both innovation and challenges along with it. kind of talking to that piece of it, especially with working with such a diverse community. I'm sure you've heard some hesitancies and misconceptions and had to kind of tackle that as a community leader as well. So what are some of the techniques or methods you would use if someone would be hesitant to telehealth or hesitant to vaccination? What were some of those discussions that you've had over this time?
Yeah, they're vast, and yeah, I don't know that I can sum it up too well, but I think that maybe there is one common approach that I try and take, and it's to just hear what other people's concerns are, whether it's telehealth or whether it's vaccinations or whether it's medication assisted treatment or harm reduction or whatever. I want to hear from people. I want to hear what they're thinking. I want to hear what they have going on in their heart and in their mind and the things that have them concerned about it or afraid of it or whatever, right? And so and I don't think enough of that happens. I don't think that there's enough listening and hearing people. And it's tricky, right? Because you don't want to like have a conversation with somebody in such a way as to think that the listening equals that you're going to agree with their issues or concerns with the vaccination or whatever. But the reality at the end of the day is that I don't think anybody allows a new thought to come in without their current thoughts being processed and heard and understood. I don't like it when somebody just comes and tells me what they think, but they're not willing to listen to what I think. Even if what I think is way off base, I still want to be heard. I just don't want to, I mean, maybe it's a flaw in my character, but I don't want to listen to what somebody else has to say about how wrong I am without understanding why I think what I do. So I try and pay that same respect to others. And that seems to be maybe the most effective way in my experience of helping people gain more information. And then also not expecting that folks are going to walk away from a single conversation or even 5 conversations and have a changed perspective. It just takes some time. We've had experiences I found, when some of the vaccination mandates came out around people working in particular environments and folks being extremely upset about that. When push came to shove and folks ultimately would decide to do one thing or the other, keep their job and get vaccinated, or leave their job and not get vaccinated. For those who I have talked with who made the choice to get vaccinated, once they sat and really poured over the information that was out there, they realized that much of what they were being told was way off base, or they weren't really receiving or involving themselves in any of the actual information. They just had somebody telling them that this is bad for these in general reasons, and never having investigated it themselves. And once they did that, they were like, oh my goodness, I can't believe those were some of the arguments that were in opposition to vaccination. But again, it's just it's with everything. It can be so loaded for people, right? There's a lot of information, and that's one of the, I guess, bad things about easy access to information online, is that we just have information glut, and it's just hard for people to work their way through all that information. And so again, comes back to those still listening to people, hearing what they have to say, understanding what their fears are in a respectful fashion, so.
Yeah. And, while trying to, be very respectful of anybody's, particular privacy or anything, are there any, particular success stories that come to mind, either through those conversations or through the programs that you're offering, that have really stuck with you as, resulting from these different efforts of food delivery, of connecting to care, things like that? Are there any of those stories that kind of that come to you through your heart and through your memory?
Well, I would say big picture, to discover how many people are underserved within Lewis County. I mean, we know that this is true but we haven't necessarily had a clear mechanism to connect with some of the individuals in the community that have great need, especially in the, again, vastness of Lewis County. So we're talking, south end, east side, west side of Lewis County. And one of the positive outcomes of the food box transformation in the delivery system has been being able to make contact with individuals that, again, are part of this way out there part of Lewis County, and to both discover their need, but also for them to discover, as isolated as they can be, that there are people in the community, in their own communities, in their own county, that care about them and are not just ignoring what they have going on, but that they're willing to step up and bring them food in this case, and that has brought about bigger change than just that as well. So some of those families, for example, have found out other service opportunities, services that are offered in the community. So another program that we have that was also very challenging during COVID is Parents as Teachers, and it is a home visitation parent education program. And we have sent out flyers in our food boxes to communicate that resource availability. And so we've had families that have been able to connect with parenting education resources and have a home visitor come, just simply because it started with the food box being delivered, right? So, and I think about situations like that and the potential for that to not just meet an immediate need, as important as that is, but transform a household, right? To transform a generation, where a lot of families just have gone not knowing good methods for parenting, right? And so now they have, oh, hey, look, there's this opportunity to get some parenting education, and the positive impact that can have on the children, who then grow up with a different experience than maybe the parent had, that can continue to move that forward. And so many stories too of just folks, whether it's some of our outreach efforts that are aside from any, I've talked a lot about food service stuff, and that's just a portion of what we do, but that have just experienced a sense of connectedness at a time when people have been very isolated, and being then compelled to pursue maybe some additional help and some additional resources, and maybe some more positive direction in their life. So as for super specific instances and examples, there's a gentleman that started showing up, hanging out at our cafe and outside, since we weren't open inside yet. And he was just like lingering outside every single day, and was quite unwilling to interact, it seemed, with people. Long story short, this individual was unhoused, had been unhoused for about 6 months, had lost his house. He lived with his sister. His sister passed away, and he was not able to maintain the home that she was in. And it seemed as though he was maybe struggling with some behavioral health crises or some substance use disorder. After we were able to connect with him for a time, it turns out that he was unable to maintain connection with his primary care doctor, and he's diabetic. And so he was not able to be on his insulin that was just messing with him big time. And through the access to the food resources, he was there, connects with one of our care navigators, who then helps over a period of, it was really like almost a month to figure this out, discover that he's diabetic and not on his insulin. And again, it was just making him irritable and really causing him a lot of problems. And so we were able to figure out how then to get him reconnected through telehealth with his primary care doctor, and get him all the way back to housed, not just stable medically, but back into the situation of being housed. And, those kind of things happen on a regular basis anyway. However, this was like both fueled by the pandemic in part, and also the issues around just housing in general. And so to be able to meet that need, it's just like he still calls us on a regular basis just to check in, and thinks of the community here as his family. It's beautiful.
That's amazing. And with having that kind of impact on someone's life, it's just such a key thing that you can provide to the community, and that so many people within your organization, your volunteers, and I think it's just a fantastic thing to hear about.
Yeah.
So I think that kind of brings me to another question, which is, going forward from here, what are the things that you envision? Like what would be the things you hope to see continue, that you'd like to initiate now that we are seeing more people become vaccinated, that we're managing some more of these pandemic elements, and we're kind of entering this new phase of what does Washington look like, what does Lewis County look like? What are those things that you would look forward to coming forward?
Yeah. Hmm. That's a big question. So I would say, I'm going to answer your question, but I'm going to do it in a little bit of a roundabout way.
It is a big question, so.
yeah, and that's good. I like big questions because they justify long answers, and I have a tendency to give long answers. So when it comes to where we currently are, one of the things that I want us to remember is where we have been since the pandemic hit us, because it seems like as things open back up and people are vaccinated and people are sharing time and space again together, folks have been quick to forget how hard these last couple of years has been. And not all, and I get that, like, it's not always wonderful to reflect back on traumatic times, right? But one of the negative outworkings of forgetting is that we aren't as gracious and kind with one another as we need to be. I have watched service providers in our own community just work their fingers to the bone to try and take care of people. And some have more recently been kind of criticized for, like, oh, this isn't what you're doing isn't working or whatever, right? And so, and this isn't just in our community. I hear about this and see these things happening in many communities. And it's as if people forgot just how hard these last couple of years were. And the reality is that it has, things have in general not gotten better when it comes to folks. I mean, we've already talked about this and this is obvious, but again, I just want us to remember this. During the pandemic, people's behavioral health struggles did not get better. We did not become a healthier community, and our nation didn't become a healthier nation. Our world didn't become a healthier world during the last 2 years. Other needs did not, they only have become exacerbated. So housing has continued to be a problem, and it hasn't gotten better during the pandemic. Food insecurity on some levels, all these things, right? And now we're in the middle of struggles with inflation and growing numbers of problems with people having enough money to pay their basic needs, get their basic needs met. So I just want to, as we move and talk about where we're going from here, I don't mean this in any pessimistic way, but I just want to make sure we're remembering where we came from and where we're coming out of, and not pretend as though it hasn't been as hard as it's been. So with that said, then we are in a state where things are getting better, but we're only starting, I believe, to discover maybe even how bad some things got during the pandemic around behavioral health and around substance use, namely. So I think that we're still trying to figure out how we respond to some of that, and how we start to bring about some healthier outcomes and such. So where we go, we continue to assess the needs. We continue to meet the need as we see it. So for us, part of that means expanding some of our behavioral healthcare services, expanding our medication assisted treatment services, trying to, as we've discovered, again, not surprisingly, more and more need within farther outreaches of the county, coming up with solutions to get two people there, not expecting people to come into Centralia. It's a 45 minutes, an hour long drive, depending. And so we're working to offer some of those services in a mobile format. I think I mentioned that earlier. And so I'm hopeful that, as we've discovered the need, and also importantly, built relationships with people, throughout the rest of the county, that we can mobilize and respond and going to where people are, so that they're not only pre-existing needs, but those that seem to have been escalated during COVID can be met. So holistically for our community, though I don't see this happening right now, just yet, but I'm very hopeful, is that more conversations happen across tables, right? Like people that don't necessarily see eye to eye on something. I want people to be able to come together and have conversation in the same way I mentioned earlier about, listening to folks that are struggling to embrace a vaccination or whatever that struggle they might have is, listening to them. I want to see that happening on a larger scale within our community, but that's like really hard work, right? I like peace, but I don't like fake peace, right? I don't want peace that's just ignoring every problem and pretending as though things don't exist and as issues, and that we all are just getting along just fine. I guess that is better than some alternatives at times, but it's not the ideal. The ideal is we don't necessarily even have to agree on everything, but at least be able to sit at a table together and have a discussion about what differences we have. I don't, regardless of, and there are always exceptions, but I find that most people within a community that are involved in their community at all are after similar things. They just have differing ideas about how to bring about those desired outcomes. And if we can start from at least a shared perspective that folks are wanting positive change in a community, or positive change for individuals that make up that community, that from that vantage point, we can sit down and discuss how we're going to go about that. And again, still might disagree, but at least we can see that there are things that we agree on. And that's, again, hard work. That's the hard work of peacemaking and community building. And, we're not there yet. We're learning how to do that all the time, and making mistakes and doing that and trying to do that. And, but the reality is, again, it's just, that's hard work, but that's where I hope we can go in rebuilding our community. So communities. Yeah.
Excellent. Yeah. So it sounds like, and forgive me if I'm not hearing it all quite right, but it sounds like the call to action that we might want to push out to that community and within our faith communities, within our regional communities, is to really take that time to listen and to have that open-mindedness with that, and to really gather and come together with some innovation as we try to go forward and in trying those new things. And some things might not work and some things might work great. And I think that's a really interesting call to action, is just that listen and gather and see what we can come up with as a community at large.
Yeah. And I'm not like, some, head in the mud, sand, denying reality. Like, I understand what a lot of our work faces a lot of criticism and scrutiny. And so, like, I'm not speaking to the call to that based on some kind of Pollyannish expectations that everything is just going to be fine. We should just, hold hands and sing together and it'll all be great, right? Like, this is really, really hard work on a really divisive issues, but that's still the hard work that needs to happen.
Absolutely. Great.
Yeah.
So with that, if there was a way that someone wanted to get involved with Gather Church, with the programs that you do, what is the best way that someone might be able to get in contact with your organization?
Yeah, so you can email us. You can go onto our website, just gatherchurch.com, and there's information on there about connecting with us. You can send us an email at info@gatherchurch.com. You can just call us directly, and some lovely person will answer the phone, and or you'll get to leave a message, and a lovely person will call you back, and they can share with you information about ways to get involved. Generally speaking, the first and best way to do that is to make that initial contact, and then just come and have a tour, walk through. It's lovely to be able to do that again too. And it's a very broad scope of work that we're involved with. And so there's, many opportunities. And so getting people here and showing them around and introducing them to people and in a bigger scope of what we do is kind of step one. And even if people aren't interested in being involved necessarily, but they just want to know more about what we do, certainly hit us up. Love to share with folks what goes on around here. So.
Excellent. Well, I'm sure that we'll get lots of people reaching out, hopefully,
I look forward to
with this episode. So again, I just want to thank you again, Cole, for being on with me today. Any final thoughts or anything else you'd like to add before we sign off?
No, just thanks to you for asking me to participate in this and for your doing of this podcast too. So.
Thank you. And to our listeners, we look forward to having another episode soon. So stay tuned, and we hope you have a great day. Thank you so much.
The content shared in this episode is for informational purposes only and does not constitute medical advice. Please consult with your healthcare provider about any medical concerns you may have. Reference to any specific product or entity does not constitute an endorsement or recommendation by Choice Regional Health Network. The views and opinions expressed by guests and Choice employees are their own and do not necessarily reflect the official views of the Choice organization. Choice Regional Health Network follows all guidelines set up by the Center for Disease Control and Prevention and the World Health Organization.